Thanks everyone for the opportunity. Isaac was just telling me that last year's GRIN, which I wasn't able to attend, I heard you had a Wendy Foden, and she did an activity in the forest. It was around the mental health for conservationists. I'm just curious, how many of you regularly, or at least in the last 2 weeks, take, say, at least 20 minutes in a day just to sit still and observe nature, whether it's from your stoep, in your garden, nature indoors, to regularly notice? That's great. You don't have to be shy. These responses are covered by the Popey Act, so you can. How many of you have, say, acknowledged the beauty of nature somehow in your life in the last 2 weeks, whether through some sort of art, music, dance, journal, reflection? Cool. By the way, and this is in your own personal life, of course, you can't do it professionally, it doesn't count. And then maybe how many of you can remember your journey here today, and what you noticed in nature on the way here? Did you notice any particular birds, any flowers that were in bloom, anything like that? Yeah, cool. And if your doctor told you to do it, would you do it more? So that's what I'm going to talk about right now, and I don't want to repeat what I did 2 years ago, but you probably don't remember it anyway, but I'm sort of building on that, which is more about nature connection and nature contact. And the context for this presentation is really that since that time, the state of South African mental health in particular has decreased even further, but there's much more evidence around nature contact and nature connection. And there's been much more work done on nature prescriptions in terms of pilots and reviews of those programs. So as a brief recap, the situation, as I said, has gotten worse. We had about 600 calls registered to the South African Depression and Anxiety Group in 2019, 1,400 during lockdown, and we're now up to 3,000, around about 300% increase in the last few years, and that doesn't account for all the SMSs, emails, WhatsApps, and what have you that they field and don't record. 27% of the population is estimated to be suffering from some form of depression at the moment, and absenteeism is costing billions to the economy, as is presenteeism, which I referred to a couple of years ago, whereas when you show up to work and don't perform. And less than 1 in 10 South Africans are probably actually getting the help they need, and about anywhere between 75 to 95% of the population don't have any access to sort of mental health services. So it's a big problem, and these sorts of neuropsychiatric issues are estimated to be about the third highest contributor to disease, but it's not acknowledged much in our mainstream discourse. But research continues to show what a lot of us intuitively know, and that nature has profound effects on our health and well-being. And there's more and more evidence around this. And just in the last couple of years, the proliferation of papers is huge, and I tend even not to cite individual studies anymore. I'm just going to the systematic reviews and meta-analysis because they're obviously far more meaningful. We're seeing that even as little as 10 minutes a day can actually help adults with mental illness. That psychological and physical connections with nature improve human well-being and nature conservation, and that's a really important point that I emphasised last time, and I might come back to this time. And we're seeing this across a range of disciplines and journals. So this last one actually was in the Journal of Clinical Medicine, where we're seeing that nature walks are an effective intervention for anxiety and depression. So a big summary here is that the moments matter most. And I've said it before that it's not just contact with nature, but the nature of the contact. And this is what the research is showing, that it's more than just time spent in nature, more than just knowledge about nature, and more than just only access to nature. A lot of policy interventions talk about access, and it's important, it's necessary, but it doesn't guarantee connection. And this paper in Nature Scientific Reports earlier this year was a population level study, albeit from Australia, but it showed that a lower connection to nature is related to lower mental health benefits from nature contacts. Even if you have the nature contact and your connection's not there, the benefits for your mental health are lower. And so there's this continuum that it's the quality of our spaces, which either we create through nature design or we conserve through the work we do. There's the contact, the exposure, And then there's this other level of nature connection and engagement. If your spaces are your green infrastructure or your hardware, then I'd like to see nature connection as the user interface. Your smartphone's not much use without an app to engage with it. And this dictates the quality of our engagement. This is coming out in big international reports now. From last year, the European Environmental Agency emphasised this in the take-home message that our relationship with nature needs redefining from one of extraction to one of care. Human-nature connectedness should be strengthened through our social norms and value systems and how we live our everyday lives. I don't think anyone here would disagree with that. But what's interesting is the implication is that even if we reach our biodiversity targets, even if we reach our climate targets and everything else we hope for, if we haven't addressed the human-nature relationship, then those targets were arguably meaningless. So on the back of all this is, well, how do we bring it more into health? And so there's been this uptake now of this idea of prescribing nature. Now the idea is not new. It arguably came on the map with the Japanese and Shinrin-yoku forest bathing in the 80s. New Zealand got on board with a form of it in the 90s, and it's been happening. But the last decade, particularly the last 5 years, it's really taking hold. And there's a range of terms of this that you'll hear. I won't go through them all, but the one that we've chosen to land on is nature referrals for reasons I won't go into right now. It's a bit softer, and it also aligns with some of the with the government language. But it's been happening. And so what is a nature referral, or what is nature on prescription? It's these complementary, non-clinical, nature-based interventions that a healthcare professional can formally recommend or prescribe to a patient or client. And what it does is it links people from primary care, social care, or other referral routes to nature-based activities to promote a range of health and wellbeing outcomes for optimal health and wellbeing. And it's particularly good for mild to moderate stress and anxiety, for, say, high diabetes and physical health issues around that. And the reviews have been showing that it actually helps cardiometabolic outcomes, mental health outcomes, physical activity, and when there's the connection component, it supports pro-social and pro-ecological behaviours. So again, a lot of evidence on the prescription side of things as well, also some systematic reviews and meta-analysis as well. A key one up there in the top right is that it also can address the loneliness epidemic, which many of the Anglophonic societies are experiencing at the moment. The big paper down there from Nguyen was looking about this cardiometabolic and mental health outcomes, but also we're seeing articles pop up in journals for GPs as well. And then the RSPB pilot in Scotland was also very effective in terms of its outcomes. But the one I really want to focus on has just been released recently, and this was the Green Academy for Social Prescribing, the Social Prescribing Academy in the UK, and they had 8,300 people, and they found that it improved happiness, life satisfaction, and they were engaging in these activities like horticulture, like conservation work, and nature-based exercise groups. But one really important finding was that these interventions were reducing health inequalities, and they had at least 50% of those 8,300 were from low socioeconomic groups in the UK, were from ethnic groups and what you would call minority groups in the UK, and that it was actually reducing the demand on the healthcare system. So there's real potential there. And then on the back of all that, we're getting a lot of popular media around this now as well, around whether it's time for the doctor to give you a prescription and so forth. There's been quite a few studies now on the impacts of birding and birdsong on health and wellbeing, and the sub-line of that Guardian article was that maybe doctors should be prescribing bird watching as well. So, and I was reached out to by a journalist from the Odyssey magazine, so this month's Odyssey has an article on nature referrals. I understand Odyssey magazine is widely read by the medical fraternity. So that was a joke. But we'd like to get a bit more media happening from this work, and I have now got a relationship happening with the South African Society for Integrative Medicine. So what this work is trying to do is bridge prescribers, your healthcare professionals, with providers, so people who are offering nature-based activities, and then linking them with patients and actually place-based relationships that we can develop this health ecosystem that we can see our green spaces as health hubs where these sorts of activities can happen to cultivate a sense of place and support community contexts. So we've had a couple of workshops so far, some CPD workshops for healthcare professionals, as well as bringing together providers and prescribers just to discuss how can this work effectively, what do we need to think about. And on the basis of those sort of workshops, we have been going forth and sort of trying to work toward a pilot. Obviously, there's different pathways and there's different strokes for different folks. So you really have to look at this from a prescriber perspective. They can work with the individual and recommend and prescribe activities just to say, okay, can you for 2 times a week go out and do this? But there's not much really control over what they do and how they do it. You can give them other self-guided activities, and I'll get to the NatureFix app in a moment. You can bring the outdoors inside, and this is particularly prevalent for mobility issues or accessibility constraints to access nature. There is also evidence that vicarious nature viewing through screens can help, not the same as being outdoors, but there are those options. Or you can ask a nature provider for a one-on-one session. What we're particularly interested in is the group stuff, so actually referring to a nature provider, someone who's doing hikes, forest bathing, kayaking, canoeing, bird watching, gardening, to actually almost buddy as a nature buddy, work in specific sort of group contexts as a therapeutic nature-based intervention. The emphasis we have to tell doctors is this is not therapy, it's a therapeutic intervention. They get a bit nervous if you speak about therapy, it's a therapeutic intervention. So you can also link up with your local clubs if they're around, like a bird club or Keep Plet Clean and so forth. So with the self-guided wellness trails, one of my other projects I'm involved in is with NatureFix as a scientific advisor there, and it's an evidence-led program where we have an app and these wellness trails. The app is geolocated and we have these routines, these audio routines you can listen to help you notice better, to help you pay attention in ways that you might not normally do if you're just going for a walk by yourself. I won't go into detail here, but just to say that we have the first ones installed in South Africa, down in Nature's Valley, and we thank NVT for seeing the potential in that. So in the healthcare professionals I've been speaking to, I've been saying to them, look, you can also encourage people to head down to Nature's Valley and try out this particular trail. In Australia, we have a number of trails with hospital campuses, university campuses, and other forestry areas and so forth. And we have now developed a handbook for healthcare professionals. I'm only working about half a dozen at the moment. I'm working with sort of low-hanging fruits. This is funded purely out of Kwendalo, where I work at the moment. So we are looking at bigger funding to expand this. But this handbook is really providing an overview of how could healthcare professionals actually engage with this. What do they need to think about? What are steps for implementation? And I've drawn on a number of papers and studies and other work done around the world to put this together so it's locally relevant. And then starting to pull together a few providers in Plet. And I don't know why I want to kiss this microphone. I'm just a few providers in Plet and Neisner. So, and those providers are people who are actually willing to take people out into nature. So that's just an example of the providers page. We've got a couple of pages there, also working with the Robert Coastal Corridor as well. And then up the top there, with the NatureFix stuff, we have an online 10-day program that anybody can do. The guys are through a series of exercises designed to increase one's connection with nature. So going forward, there's some challenges and considerations, as you might expect. Opportunities, firstly, is that South African Depression and Anxiety Group has acknowledged that our healthcare system here is overwhelmed, and they've really called for the importance of shared care, and that non-healthcare professionals should be able to get involved with their communities to have this sort of collaborative care ecosystem. So I think that is an avenue for this sort of work to say, well, this is what we're trying to speak to. Because sometimes HSPCA registered professionals get a bit nervous about anyone stepping into that space if they're not suitably qualified. So we've had to navigate that a bit. And there are some big questions, of course. What is the actual healthcare sector uptake? Is this just conservation, once again, trying to find a way to get people to care, to get people into nature? That's what it's felt like for me a bit as a conservationist by background. Do they have the time and capacity to engage? There is genuine interest. I've seen that, but they're notoriously difficult to track down, to arrange meetings with. So, how can we meet their real needs? The framing, the language, as I said, the territories as to whose territory is this to work in. Can we get medical aid buy-in? I've seen it given for some things, but this, based on the evidence, is a no-brainer. But yet it has to really be presented to them in a particular kind of way. Can it be scalable across sectors? And I mean, there's many other questions as well. I mean, there's no part-time nature. Nature should play a full-time role in our life, but obviously we tend to just compartmentalise it into something we do on the weekends or here, there and everywhere. Accessibility issues, affordability issues, is it appropriate for all sectors? Obviously not. And I've got some questions. I'm making sure there's not a blind spot from the beginning. I'm talking here with Justin Bernardo, who's pictured here. He's chief of the Crunshook community outside of Plett, about how we can make this meaningful within his context. He's noticing the interest within his community to get out in nature more. He's seeing that, especially in the women. And so he's seeing there's an actual leverage point there, or an entry point. So we'll see what we can do. And obviously what portable and durable tools can be imparted in this process. So one thing to leave with here is that the door of the party might be wide open, but it doesn't mean you're going to walk inside. And so there's a real balance there between opportunity and access, but also the orientation and engagement. And so how can we work that, bridge that gap, that people who may feel a bit reluctant to step into nature can actually walk into nature? And will having a doctor prescribe that to somebody that they can trust and feel safe with, will that help increase that uptake, not just once off, but actually something that becomes a part of their everyday life? Thanks very much. And if you want to join me on the struggle bus, contact me at institute@Quindalo. Cheers.